12 diabetes nighttime signs you can't ignore. While you dream, diabetes whispers. 12 midnight signs that demand your wakeful attention. Have you ever wondered what mysteries unfold in the shadows of your sleep when the moon takes the front stage and the hustle of the day fades into the quiet whispers of the night? Is there a secret conversation going on between your body and your constant companion, diabetes? Have you ever wondered what diabetes does at night? We're revealing the 12 diabetic nighttime symptoms you shouldn't ignore. This information is not just useful, it might save a person's life. Are you ready? Let's kick things off with number 12. Snoring. Now, pay close attention. Snoring may appear to be merely a midnight nuisance that disturbs your partner, and sometimes even the neighbors. But what if I told you that this seemingly innocuous conduct could be an early warning sign of something far more serious? We're not simply talking about disturbing a good night's sleep. People who snore frequently are more likely to develop insulin resistance, according to research published in the Journal of Sleep. Insulin resistance is a huge red flag for diabetes that you cannot afford to ignore. So, what happens in your body when you snore? When you snore, you have small disruptions in your breathing. These disruptions can activate stress reactions in your body, resulting in an increase in stress chemicals like cortisol. Stress hormones can mess with your blood sugar levels, producing a chaotic environment for diabetes to thrive. Simple lifestyle adjustments, such as losing weight, reducing alcohol use, and even changing your sleeping posture, can occasionally alleviate snoring. 11. Sleep disturbances. I'm not simply talking about tossing and turning or experiencing nightmares about missing a deadline. I'm talking about the kind of interruptions that jolt you awake and keep you awake, tossing and turning in a state of restless agitation. According to a study published in the Journal of Sleep Research, sleep disturbances may be connected to poor glucose control and aggravating diabetic symptoms. If you're waking up frequently or having difficulties getting back asleep, your body may be sending you a warning signal. Aside from making your bedroom a sleep haven by utilizing dark shades, white noise generators, or practicing relaxation techniques, these difficulties may need to be explored with your healthcare professional. Persistent sleep abnormalities may necessitate further evaluation and maybe medication to manage your sleep patterns. 10. Leg cramps. Anyone who has experienced a leg cramp knows what it's like to have your muscles held like a vice. Imagine experiencing that while attempting to sleep. But did you know that excruciating leg cramps can be caused by high blood sugar levels? That's correct. Cramps can occur when your body is unable to correctly balance sugar and electrolytes. You could try hydrating adequately, practicing modest stretching exercises, or even massaging the affected area to reduce leg cramps. However, if leg cramps linger or become more regular, it's critical to see a doctor. It could be indicative of a serious imbalance. 9. Night sweats. Sweating can occur for a variety of reasons, like experiencing a nightmare or sleeping in a warm area, but it can also be a sign of low blood sugar levels, known as hypoglycemia. Home cures for night sweats include altering the temperature of your room, using breathable textiles for your bedding, and even taking a chilly shower before bed. However, if you have frequent night sweats, you should see a doctor. Your midnight sweats could be your body's warning sign that your blood sugar levels are dangerously low. 8. Dry mouth. Imagine waking up in the middle of the night feeling as dry as the Sahara Desert while having slept soundly in your climate-controlled bedroom. This isn't just a little annoyance that can be remedied with a sip of water. Dry mouth, also known as xerostomia in medicine, can be an obvious sign of diabetes affecting your salivary glands. To alleviate symptoms, sip water during the night or chew sugar-free gum to promote saliva. Over-the-counter saliva replacements can also assist momentarily.
While we carry on, please consider subscribing to our channel if you found this video to be informative and beneficial. Thank you.
7. Vision changes. Yes, I'm referring to the times when your night vision is fuzzier than usual, or you have difficulty adjusting to darker situations. This is not a warning indication. Ophthalmology research has shown that chronic visual problems can be early warning symptoms of diabetes, related eye diseases such as retinopathy or even cataracts. These problems can have long-term consequences for your quality of life and should not be ignored as minor inconveniences or attributed merely to aging. So, what should you do if you're having visual problems? To begin, make sure you're receiving enough rest for your eyes. Consider using blue light blocking glasses before going to bed to reduce eye strain. A healthy diet high in vitamins A, C, and E can also help preserve eye health. However, if you detect regular changes in your vision, especially at night, it's important to schedule a complete evaluation with an eye specialist. 6. Restlessness or irritability. This isn't just about having a bad night or a bad mood. Take your time to listen. Diabetes and mood swings have been linked in research. Depression and irritable symptoms were more common among diabetics than in non-diabetics, according to a study published in the journal Diabetes Care. Think about it. You're attempting to relax, yet there's this strange, restless energy. Maybe you're snapping at your loved ones or feeling generally uneasy. Could it be linked to your diabetes? Elevated blood sugar levels might interfere with your body's neurotransmitters, influencing your mood, and perhaps creating restlessness or irritability. Maintaining regulated blood sugar levels is the best way to find relief. Medication, a healthy diet, and regular exercise can help with this. 5. Fruity breath odor. Ketoacidosis, a dangerous illness that can be life-threatening if not treated swiftly, may cause an exceptionally sweet or fruity breath odor. If you or someone else senses this odor, get medical attention immediately. In such a situation, no home cure can replace the urgency of professional medical attention. This is a warning, and it should not be taken lightly. 4. Nighttime frequent thirst. Listen up if you're guzzling water bottles at night like you've been stranded at sea. Frequent thirst, particularly at night, might be another indicator of diabetes. High blood sugar levels drain moisture from your tissues, leaving you thirsty. To address this condition, you must control your blood sugar levels. Monitoring your glucose levels and eating a diabetes-friendly diet can assist. However, if the Sahara-level thirst persists, you must speak with a healthcare expert for a full investigation and a specific treatment plan. 3. Nocturia, or, in layman's terms, the irritating habit of urinating frequently during the night. It's now quite normal to wake up once or twice to use the loo. If you find yourself going to the toilet more frequently than that, your body may be indicating a more serious problem. Nocturia has been linked to greater glucose levels in the body, according to a study published in the Journal of Urology. Yes, your nighttime toilet trips may be more than simply an inconvenience. They may be a warning sign of diabetes or its consequences. Reduce your fluid consumption a couple of hours before bedtime and avoid diuretic chemicals like caffeine. If the situation does not improve, it is critical to seek medical attention for a comprehensive examination. Believe me when I say that your sleep quality is worth it. 2. Sleep apnea. Yes, those pauses in breathing at night could be more than simply snoring's unpleasant relative. A study published in the Chest Journal connected sleep apnea to insulin resistance, a precursor to diabetes. Sleep apnea affects your entire body, not just your sleep. Seeking a professional sleep study can help you evaluate the severity of your sleep apnea and the best treatment options for you, which may involve equipment like CPAP machines or even surgical operations. And now comes the moment we've all been waiting for, the number one sign you just cannot ignore. 1. Nighttime hypoglycemia. This isn't simply another symptom. It's a crucial, urgent issue that requires your immediate attention. Nighttime hypoglycemia happens when your blood sugar levels drop as you sleep. This is exceedingly risky and can lead to serious consequences such as seizures or even a diabetic coma. Diabetes care studies have highlighted the sneaky aspect of overnight hypoglycemia, where people may not even wake up despite having it. So, how can you safeguard yourself? Consistent blood sugar monitoring is essential. Eating a balanced meal or snack before going to bed can help keep sugar levels stable. And if you're at risk, set alarms to monitor your blood sugar during the night. All right, friends, that's all. From snoring to the much-feared nighttime hypoglycemia, Trust your body has a language, and those nighttime signs could be its way of ringing alarm bells. Don't forget to subscribe and leave feedback in the comments. Thanks for watching.